can hear me, but the crowd is going wild. The President of the United States is right here behind me. He's about to give a historic speech on health care. Let's listen to what he has to say.
Thank you so much. It has now been nearly a century since Teddy Roosevelt first called for health care reform. It's been attempted by nearly every president and every Congress since. And our failure to get it done year after year and decade after decade has placed a burden on families and on businesses and on taxpayers that we can no longer sustain. So I may not be the first president to take up the cause of health care reform. I am determined to be the last with your help. Than we've ever been. After debating this issue for the better part of a year, there's now agreement in Congress on about 80% of what needs to be done. 4 out of 5 committees in Congress have completed their work. Yesterday, the Finance Committee, under the leadership of Max Baucus, put out its own bill. Each bill has its strengths, and there are a lot of similarities between them. And our overall efforts have been supported by an unprecedented coalition of hospitals and seniors groups, businesses, drug companies even. Most importantly, doctors and nurses are supporting this effort. We've got medical students right here in the House. See, I just want to point out, I think it's telling, some of the people who are most enthusiastic about health care reform are the very medical professionals who have first-hand knowledge about how badly the system is. So don't stop paying attention to the folks who are spreading false charges, crazy rumors about our plan. Pay attention to the healthcare experts, the doctors and the nurses who know our system best. We've been hearing constructive criticism about these issues over the last several months because this is a big deal. That's how our democracy works. No one has all the right answers. We've all got a stake in getting this right. That's why I've said I will embrace good ideas wherever they come from. We already have. But too often during this important debate, we've also seen the same kind of partisan spectacle that has left so many people disappointed about Washington. Too many engage in scare tactics instead of honest debates. Too many use this as an opportunity to score short-term political points instead of working together to solve a long-term challenge. I've heard a lot of Republicans say they want to kill Obamacare. Some may even raise money off it. But when you ask these folks what exactly my plan does, they've got it all wrong. When you ask them what their solution is, it amounts to the same old, the same status quo that's given us higher costs and more uninsured and less security than they've ever had. It's more of the same. Look, I will not accept the status quo as a solution. Not this time, not now. The time for bickering is over. The time for games is past. Now is the season for action. Now is the time to deliver on health care reform for the American people. Just to make sure you're clear, here's what you need to know about our plan. For those who have health insurance, you'll have more security and stability. It'll provide insurance to those who don't have insurance. It will slow the growth of health care costs for our families, our businesses, and our government. Let me say, if you already have health insurance, nothing in this plan will require you to change what you have. What this plan will do is make the insurance you have work better for you. Because under this plan, listen up, young people, Under my plan, if your parents have health insurance and you're currently on their policy, you will automatically be able to keep your coverage until you're 26 years old. If your parents don't have access to health insurance, one of the ideas on the table is to give folks under 25 the chance to buy low-cost insurance that will protect you from financial ruin if you get seriously ill. Now, under this plan, it will also be against the law for insurance companies to deny you coverage because of a pre-existing condition. When I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick. Water it down when you need it the most. They'll no longer be able to place some arbitrary cap on the amount of coverage you can receive in a given lifetime or a given year. We'll place a limit on how much you can be charged for out-of-pocket expenses. In the United States, nobody should go broke because they get sick. And insurance companies will be required to cover with no extra charge routine checkups and preventive care. Because there's no reason we shouldn't be catching treatable illnesses, treatable diseases before they get worse. That makes sense, saves money and it saves lives. Now, if you don't have health insurance, the second part of this plan will finally offer you quality, affordable choices. So if you lose your job or you change jobs, you'll be able to get coverage. If you decide you want to start your own business, you'll still be able to get coverage. We'll do this by creating a new insurance exchange, a marketplace where individuals and small businesses will be able to shop for an affordable health insurance plan that works for them. That's how large companies and government employees get affordable insurance. That's how I and everyone in Congress gets affordable insurance. You should have the same thing that Congress has. Said that one of the options in the insurance exchange should be a public insurance option. Let me be clear. It would only be an option. No one would be forced to choose it. No one with insurance would be affected by it, but what it would do is provide more choice and more competition and put pressure on private insurers to make their policies affordable and treat their customers better. Now, think about it. There's some folks who said, well, this is a government takeover of healthcare. We've got public universities and private universities.